Good afternoon. My name is Mary Sullivan, and today I will be demonstrating an intramuscular injection. So, when we enter the client's room, we'll need to provide privacy by closing the door or the curtain as appropriate. Then we will perform hand hygiene. I would introduce myself and ask the patient for their name and date of birth and if they had any allergies. Our patient would say, "My name is Jason Isbell. My birthday is February 1st, 1979, and I don't have any diagnosed allergies." We would check that against the MAR and then their wristband if they had one, and then we'd perform hand hygiene, and we would put on our gloves, and I would explain to Mr. Isbell that I'm going to give him an injection of epinephrine to treat his anaphylaxis, and that the medication works as a bronchodilator, and it will help him to get back to having a normal heart rate, normal blood pressure, and normal respirations. So, breathing normally again. And so throughout this process, we'll have to check the MAR 3 times to make sure that we're giving the medication correctly. So the first time is when we get the medication out of wherever we store our medication in this facility. The second time will be as we're drawing the medication up into our syringe, and the third time would be just before we give it to the patient. This is a high alert drug, which means that we would need a second nurse to verify that we're giving the right dosage to the right dosage to the right patient according to the MAR. So we'll need to also get our 9 rights correct. The time, it's ordered now. The route, intramuscular. The indication for anaphylaxis, which is indicated by his vital signs and other symptoms. The preparation, which we'll be using a solution that is 1 milligram to 1 milliliter, and the dosage that we have is 0.5 milligrams, so we'll be drawing up 0.5 milliliters into our syringe. Also the person, and we've already identified our patient. Then we will need to make sure that our drug is not expired, and we will need to provide education for our patient, which will include why we're giving the medication and its side effects. Paradoxical bronchospasm is a possible side effect that we'll need to look out for, along with chest pain, vomiting, tachyarrhythmias, or persistent irritation. So we would ask the patient that after we give the medication to please tell us of any discomfort they're feeling or any of these potential side effects, if they're feeling them, many of which would prompt us to call a provider. Also, if the patient does not react well to the medication and it does not improve their anaphylaxis, we may need to give another dose, but that would be at the discretion of the provider. So, and of course we'll need to check that we have the right drug, which is epinephrine, the right dose, and after we give the drug, we'll need to immediately document that the drug was given. So, after all that, so we've washed our hands, we put on our gloves, then we will use an alcohol pad to scrub the hub of the medication bottle for 15 seconds. Again, making sure that the medication is not expired or that it's not discolored or there's no precipitate in it. Then we will draw up 0.5 milliliters of air into our syringe. Then we will remove the cap like that. Then we will inject the air into the medication bottle. And and then we will draw up 0.5 milliliters of epinephrine into our needle. And we will use a one-handed scoop method to get the cap back on the needle, and just making sure there's no bubbles or anything like that. And I used a 22 gauge 1-inch needle with a 1 milliliter syringe, and I would ask a second nurse to verify that is your, well, I'd ask them how much is in this and have them look at the MAR, see that the drug and the dose are correct. And so next I will scrub the injection site for 15 seconds, starting in the middle and working my way outwards. For this medication, we're going to be injecting the anterolateral site on the thigh, which is approximately here. And after we've scrubbed the site for 15 seconds from the inside out and we allow it to dry, then we're ready to give the injection. After checking the MAR one last time, which would be our third check, we'll take the cap off and we would spread the skin taut with our non-dominant hand, usually moving about an inch, and then we will inject the medication with the bevel up. We'll inject it at a 90-degree angle, and we'll put the needle in, and then after it's in, we'll inject it. And we'll hold, as we're injecting it, we will hold the syringe with our non-dominant hand, and we'll only touch the plunger when we're actually pushing the medication in. I would not have left the needle in that long, and I wouldn't be talking. And then I will take the needle out at the angle in which I inserted the needle, which is 90 degrees. I would dispose of this in the sharps container. I would put some gauze on the injection site, and I would actually massage the injection site. Normally for IM medications you would not massage it, but for epinephrine you do massage it. Epinephrine should be a rapidly acting medication with an onset of 6 to 12 minutes, with a duration of 1 to 4 hours. So massaging will help it get into the patient's system more quickly. And if needed, we would apply a Band-Aid. And again, we would ask the patient to please alert us of their symptoms, and if they're having chest pain or anything like that. And if necessary, we would call a provider again for another dose, or to let them know of any severe side effects. Another side effect that we'd be looking out for would be paradoxical bronchospasms, which is a side effect of this medication. And we would, after we gave the injection, we would take off our gloves and we would perform hand hygiene, and then we would document that we gave the medication and continue to monitor the patient and make sure that hopefully their situation is improving, and we would document all of our findings from this point forward. And that's it. Thank you.